This video in the Preventative Care series is focused on preventative care issues for toddlers and teenagers. It is important for children to have regular medical checkups even when they are not sick from the time they are born right up until they are 18 years old. Here at Pronger Smith Medical Care, we know that early testing, immunization, and preventative measures leads up to healthy adults. We are committed in partnership with you to achieve your healthiest family. At regular checkups, the doctor will make sure your family is growing and developing properly. Doctors say that children should have checkups often when they are infants and toddlers, then once per year as they get older. As kids get older, protection from some childhood vaccines begin to wear off. In addition, older kids can also develop risk from other diseases. Health checkups and sports or school physicals can be a good opportunity for your preteens and teens to get the recommended vaccines and immunizations.
In the toddler population, routine screenings are still highly recommended. Minor health conditions such as allergies, coughing, sneezing can be addressed at these visits. It is important for us to do these screenings in order to appropriately treat patients. Most of these children have already received all of their childhood immunizations and are up to date with vaccinations. There are some warning signs of allergies. They can be a chronic cough or cold-like symptoms lasting more than a week or two. Or if the cough or cold symptoms develop each year at the same time, this can also be a sign that your child is suffering from allergies. If you notice your child has itchy eyes, watery nose, snorting, coughing, sneezing, these can all be signs of untreated allergies. There are other signs and symptoms of allergies such as rashes, hives, etc. These can be seen as red patches or itchy patches on the skin. This is another indication to the provider that the child may be suffering from allergy. Contact dermatitis is a very common type of allergy on the skin. It's usually caused by soaps, lotions, detergents, or changes in the child's environment.
Although allergies and asthma often go together, they are two totally different conditions. Asthma is a chronic condition that constricts the bronchi of the lungs. Allergies are reactions that start with the immune system that may or may not affect the lung function. Most people with asthma have allergies, but not all people with allergies have asthma. Children and teenagers with asthma have symptoms ranging from out of breath to the more serious of cannot breathe at all. Asthma constricts the bronchial tubes of the lung, making it very hard to take in and release air. Many different things can trigger an asthma attack. For example, exercise, cold air, a virus, air pollution, certain fumes, and food, like nuts and gluten, as a few of the most popular. In fact, about 80% of teenagers with asthma also have allergies, and for them, allergens often are the trigger. The most common treatments are fast-acting inhalers, long-acting inhalers, and in the worst cases, steroids. Childhood obesity has both immediate and long-term effects on health and well-being. Some of the more immediate health effects on adolescents are both physical and emotional. Obese youth are more likely to have risk factors for cardiovascular disease, high cholesterol, type 2 diabetes, high blood pressure, depression, and withdrawal from society. One study showed that children who became obese as early as the age of 2 are more likely to be obese as adults. Healthy lifestyle habits, including healthy eating and physical activity, can lower the risk of becoming obese and developing related diseases. The teenage years are very trying times in many ways, especially in terms of nutrition. Adolescence is indeed a period of high nutritional risk when the increased demands of nutrition are often met with poor choices of food, unhealthy eating habits, and deficient intakes of calories and protein, as well as many vitamins and minerals. Both boys and girls tend to be deficient in nutrients, but arriving there in different ways. Boys tend to eat poorly, and girls tend to just not eat enough as they're concerned about their weight. Teenagers need to realize the importance of nutrition. Parents play a crucial role in the nutrition of their children by setting good examples, eating healthy themselves, not buying junk food, keeping the house stocked with healthy foods such as fruits, nuts, and yogurt. Make it easy for your children to make an educated, healthy choice. As kids spend more time watching TV, they spend less time running and playing. Most children need at least an hour of physical activity each day. Regular exercise helps children feel better about themselves, feel less stressed, have more energy to learn in school, build and keep healthy bones, muscle, and joints. Besides enjoying the health benefits of regular exercise, kids who are physically fit sleep better and are better able to handle physical and emotional challenges. Some examples are like running to catch a bus or just studying for a test. For kids and teens, exercise means playing and being physically active. Kids exercise when they have gym class at school, during recess, at dance or soccer practice, while riding bikes, or when playing tag. Kids who experience regular activity are healthier and happier kids. Lack of sleep can also harm a child's health. As our kids age, it becomes more and more difficult to track how much time they spend actually sleeping. Toddlers need on average up to 10 to 12 hours a night. Grade school age and teens need at least 9 hours of sleep, but the importance of sleep does not diminish. Sleep helps us solve problems, react quickly, form memories, and learn. It also affects the child's physical well-being. The body releases hormones during sleep that are needed for growth, building muscles, and repairing cells and tissues. Make sure your children are getting the recommended hours of sleep for their age group to ensure they're happy and healthy. The goal of Pronger MedicalCare's Tots to Teens Pediatric and Adolescents Preventative Healthcare Program is to empower parents, young adults, and teens to take charge of their health. Through education, healthy lifestyle choices, partnership with your healthcare provider, and early-stage preventative measures, we can all live a healthier life.
Hello, my name is Shalli Agarwal, Dr. Agarwal. I work here at Pronger Smith. I'm one of the OBGYNs that works here 4 days out of the 5. One of the questions that we get asked pretty commonly is, when should I bring my daughter in for an exam? When does she need to start seeing a gynecologist? When is it okay for her to see a pediatrician? Definitely if they have any gyne-related issues, abnormal discharge, really heavy periods, abnormal bleeding. These are all reasons that you can have your daughter meet the gynecologist early. It's great for them to get to know that there's someone in the community they can trust, they can ask their questions to. I always joke it's better than Google, it's better than your friends. You can call me, you have a resource, and that way you get to know me, so you're more comfortable asking me these questions.
At Pronger Smith Medical Care, we are fully equipped to provide you and your family with a lifetime of responsive, accessible care. From preschool to prom, we are here to help you raise healthy kids. Please schedule an appointment today.